October is Breast Cancer Awareness Month. In the United States, breast cancer is a difficult diagnosis. Patients are faced with harsh treatment regimens and life-changing decisions. That was the case for Aleseia Saunders. 4 years ago, she was diagnosed with breast cancer while pregnant. She had a difficult choice: save her baby's life or save her own. Aleseia Saunders joins us in the studio now to share her story. Aleseia, welcome to the show.
Thank you.
So you were faced with that difficult choice to make, and you said, no, you will not have an abortion, you will save your baby. What gave you that conviction to say no to your doctor?
Well, the pregnancy within itself was a blessing, and I was so ecstatic to be expecting my first child that I felt that I could not allow someone else to determine whether or not I was going to become a mom. And when the first doctor advised me of immediate termination, I'm the type of person I just could not take no for an answer. I had to do my research and had to seek other opinions.
And then what did you do? What type of treatment did you have to go through to save your baby and your life?
Well, the first doctor, as I stated, mentioned immediate termination. He then set up a treatment plan of chemotherapy in which could possibly harm the baby. I sought a second opinion of another breast surgeon as well as a team of doctors at Johns Hopkins University. And they felt that with my with having no family history as well as my age, and then did a genetic test to determine that chemotherapy would actually hurt me more than it would help me. It would also harm the baby, you know, other than help. So they laid out a treatment plan of me having a lumpectomy within my second trimester. And after delivery of my daughter, I had 37 rounds of radiation, and then I was prescribed a hormonal therapy, which they used to suggest for 5 years, but now they recommend for 10.
This goes to show also the importance of second opinion very often when we are faced with some diagnosis, right?
Correct, correct. As I stated, I'm big, and my personal life, no is not the final answer always. And, you know, although I had this doctor who looked at me as a patient and wanted to be aggressive with treating me, because as you stated, they were more concerned about saving my life versus, you know, my baby's. But I felt that both of us stood a chance. And I'm thankful that, you know, I sought other opinions and that I went and did my research so that I was able to successfully save both of us.
4 years later, you have a beautiful daughter. I saw her pictures. She's so lovely.
Thank you.
What have you learned through this journey?
I've learned to do your due diligence, you know, stay focused, pray on it, seek support. You know, seek other opinions, gather your support group, those who will back you with, you know, possibly exploring alternatives. Don't always take the first answer as the only answer. You know, if I had done that, then as you stated, my daughter wouldn't be here, and then I would wonder what if. But I'm so thankful that I decided to do otherwise, and she is here for me to enjoy her. She's healthy, I'm healthy, and I couldn't be happier.
And women will see you and will be very encouraged by your story. What do you want to tell the women who have to go through your experience? A woman, for example, who just got diagnosed with breast cancer while pregnant.
Well, I want to let them know that it's okay to have fear. It's okay to cry. I cried many, many tears. But then turn that around and focus and don't give up hope. You know, stay hopeful, pray on it, as I stated, seek support, do your research, just know that there are other options. Don't allow one person to dictate your future. Of course, we know there's a greater being that lays it out for all of us. I just want them to know to always give up hope, because there is life after cancer.
Do not give up hope, indeed, and you did not, and we appreciate your story. Thank you so much.
Thank you for having
being
me.
here. We appreciate you. And that was Aleseia Saunders. She is a breast cancer survivor.